Hello everyone, this lecture video is all about diabetes mellitus. So, diabetes is commonly known and usually called as simply as diabetes. Then, this is a metabolic disorder characterized by elevated levels of glucose in the blood. The classic symptoms associated with an uncontrolled diabetic conditions is frequent urination, increased thirst, and increased hunger. Symptoms are the basis for the name diabetes mellitus, which originates from the Greek words diabetes meaning siphon and mellitus meaning sweet. The Greek physician Aratius Cappadocian coined this name because he observed that the body of some people acts like a siphon. It acts like a siphon in which they are taking water in at one end, this one, at one end here, and discharging it at the other. And that the urine produced was sweet to taste. So that is why the name of diabetes mellitus can roughly be translated as sweet urine. Then the diagnosis for diabetes mellitus is based on the measurement of fasting blood glucose levels. So a blood glucose level that is greater than 126 milligrams per deciliter is considered to be positive, and a blood glucose level that is less than 100 milligrams per deciliter is considered as negative. Then, the blood glucose level between 100 to 126 is considered pre-diabetic, meaning to say the blood glucose level is higher than it should be but not high enough to be classified as diabetic. So, there are two major forms of diabetes. We have here the type 1, which is insulin dependent, and type 2, which is non-insulin dependent. Let us discuss first the type 1 diabetes. So this is the result of inadequate insulin production by the beta cells of pancreas. Control of this condition involves insulin injections and special dietary programs, but there is a risk associated with insulin injection. Too much insulin can produce severe hyperglycemia or insulin shock, in which this insulin shock will lead to blackout and coma. So the treatment for this is quick infusion of glucose, and often the diabetics often carry candy bars, which is quick glucose sources, for use if they feel any of the symptoms that signal the onset of insulin shock. Type 2 diabetes, let us proceed here. This results from insulin resistance. This is a condition in which cells fail to use insulin properly. Bodily insulin production may be normal, but the cells do not respond to it normally. So the treatment of this one involves the use of medications that decrease the production and or increase insulin levels, as well as carefully regulated diet to decrease the obesity if the latter is the problem. So, the more efficient use of undamaged insulin receptors occurs at increased insulin levels. Then, 10% of population that have a diabetes are type 1, and the remaining 90% are all type 2. The effects of both types of diabetes are the same. They have both the inadequate glucose uptake by the cells. The result is blood glucose levels that has a much higher than normal, and this is what we call the hyperglycemia. So, the control mechanism of the body must be, because not all body responds to it as it should be. The cells must resort to other procedures for energy production because the glucose cannot enter the cells, so it must break down fats and proteins for other energy resources. And then, for testing of the diabetes. First, a person must fast for 8 hours prior to testing. Then, a blood sample is taken at the beginning of the test. Then, the patient will drink 50 grams of glucose beverage. Then, after that, a second blood sample is taken 2 hours later. So, it will measure the test here based on the hours. Then, most people with diabetes take oral medication rather than insulin. Or rather than insulin injection. So, they are taking most commonly is the Metformin. So, this is a non-cyclic organic compound that contains more nitrogen atoms, 5 nitrogen atoms than carbon atoms, which is only 4. So it does not increase how much insulin the pancreas make. Rather, it acts in the liver, decreasing the amount of glucose it produces. Why in liver? Because an average person with type 2 diabetes has a gluconeogenesis rate that is 3 times the normal rate. So what happens is the metformin slows down the production of glucose via gluconeogenesis. So that is all for diabetes mellitus.